And welcome back. The pandemic has, of course, meant that we've been in social isolation for months, many months. This can be especially hard if you live alone. Joining me now is Aimee Donnelly. She's a wellness coordinator for Network Health with some resources to stay social and also be safe during the cold winter months. Good morning to you, Aimee.
Good morning, Molly.
This is such an important topic. We focus so much on immunity and health and wellness because of this pandemic, but I think the emotional and mental part is so important too. So how do you see this pandemic affecting mental health conditions?
Yeah, this pandemic and the quarantine has had a big impact on everyone's mental health. Over 53% of adults have said that they've had a negative impact on their mental health. Some of the big reasons we're seeing are the loss of jobs or income, isolating from those family and friends, and the stress from those mounting bills that you have from house and medical bills. We've taken so much responsibility in taking care of our physical health and not getting sick that mental health has really gone to the wayside. So we have to pick that up and change that.
I think you make such a good point there, Aimee. And you mentioned stress in particular. The holidays are typically a time where people experience more stress maybe than during the rest of the year. Compound that with the financial aspects that you mentioned. So I wonder what you suggest to lower or try to manage our stress.
Yeah, we're really going to get hit here pretty soon with, like you mentioned, that holiday stress. That can come from busy work season, the financial aspect of stress and gift giving. And honestly, some family dynamics have had a bigger strain this year with people canceling and not being able to see each other. So it's really important to take care of your mental health and stress. Three things that you can do easily are hone in on your nutrition. So start making healthier choices. I know during the quarantine, we've been eating a little unhealthy. So try to make sure that you're having a colorful diet. I'm not talking about Skittles and Starburst. We want more fruits and veggies. Um, and then the next thing you can think about is your sleep. So you want at least 7 to 8 hours of sleep. Sleep helps repair your body and it helps regulate hormones, and that can help with your stress. And lastly, stay physically active. Try to move your body at least once a day. It doesn't have to be a half hour, but get some movement in. Your movement will help release stress and actually releases endorphins that make us happy.
Darn it, Aimee, I love Skittles.
I
um,
know I hit home
let's
for too many people there.
Yeah, you did for sure. Eating a colorful diet. Let's talk a little bit then too about the social isolation because especially as it gets colder. I mean, when it was warm out, we could all be outside and sit really far apart with masks on. What do you
Mhm.
suggest as it gets colder?
All right, I'm going to challenge some people, but enjoy this winter weather that we have in Wisconsin. We have a lot of great light shows that are outdoors. So grab that hot chocolate, grab that coffee, bundle up, obviously. But being outside will allow us to have that 6 feet distance and wear a mask and still see people. Now, when it gets too cold, so many virtual options. We have Zoom, we have FaceTime, any of those apps that you have. Try to host events on there. It can be Christmas, it can be workouts or happy hours. There's so many options. Um, and lastly, something that you can do is get creative. Snail mail is so much fun now. Wouldn't it be nice to have something in your mailbox other than bills? You can also reach out to your local nursing homes to see if you can make them holiday cards for the residents there. So get creative with things that you can do indoors.
So many great ideas, Aimee. I appreciate
Mhm.
that. One other
Yeah.
thing that we talk about a lot, we hear this term self-care, but I don't know if people always know exactly what that means or how they can practice good self-care in their own homes and in their own lives.
Definitely. A lot of people think that self care are those fun face masks you can do and a nice bubble bath. While, yes, that is self care for some, it's not for all. When we think of self care is actually an activity that you do that will deliberately help your well being. So, help you mentally, physically, and socially. So, as you can see, it's different for everyone else. So, think of those things that refuel you rather than take from you. So, this could be a 15-minute workout, having a virtual therapy session, meditation, anything that really refuels you. Try to do these things and take that time out of your day daily or at least weekly. That will help you out a lot.
Such great tips, Aimee. I
Mhm.
always love having you join us, not just because you have great suggestions, but you're also such a happy, bubbly person. You do a great job. Thank you so
Thank you.
much.
Yeah.
Absolutely. We want to give some people information, resources for mental health help. So here you go. For mental health help, you can call any of these numbers. If you miss these numbers, we always repost them on our website, themorningblend.com. So first, there's the Milwaukee Warm Line at 414-777-4729, or you could call the folks at NAMI. Their number is 800-950-NAMI, or try the COPE hotline. That number is 262-377-2673. Network Health Insurance members can contact their website for mental health support also. That's, there you see it there, it's networkhealth.com.